My name is Robert Garwood. I'm a surgeon at Centera RMH Medical Center in Harrisonburg, Virginia. I'm an advanced laparoscopically trained general and bariatric surgeon who performs laparoscopic inguinal hernia repair using ProGrip Laparoscopic Self-Fixating mesh. I've been in practice 10 years here and have performed over 600 laparoscopic inguinal hernia repairs. Not only have I repaired hundreds of inguinal hernias, I'm also had an inguinal hernia. This was first diagnosed in 2012 and was not causing me too much difficulty. Being a stubborn surgeon, I chose the course of watchful waiting. Over the course of time, however, I started to develop symptoms and needed something to be done. My two passions in life are surgery and cycling, competitive cycling to be exact. And I first noted symptoms of my hernia while training for my favorite event, time trialing. Being somewhat a rigorous activity involving the legs and the groin area, symptoms were very marked during strenuous effort. And over time, the pain became too much for me to bear and was affecting my ability to pursue this passion. That's when I sought surgical treatment. Naturally, I chose the procedure that I'm most comfortable with, a laparoscopic repair using laparoscopic ProGrip mesh. Why did I choose a laparoscopic repair? Well, simple. I have first-hand knowledge of the outcomes, which are excellent, and I also wanted to get back to my activities and passions, being cycling, as soon as possible. Proceeding with a laparoscopic repair using lap ProGrip mesh afforded me the best chance to do that, and I was not disappointed. There are several benefits of using lap ProGrip mesh for a laparoscopic inguinal hernia repair with either transperitoneal or extraperitoneal technique versus other meshes. The self-fixating nature of the mesh allows us to place a mesh in an anatomically appropriate position to cover the hernia defects without additional fixation devices such as tacks. These devices can often cause additional pain and nerve entrapment that complicate the postoperative course of patients. In addition, the self-fixation does not allow the mesh to migrate, which is one of the biggest reasons for postoperative hernia recurrence. In 2014, I was fortunate enough to reach my goal and win the race that was always my dream to win, World Time Trial Championships for age groups 50 to 54. As a patient, I had no regrets at all. I've been able to return to my normal activity both as a surgeon and as an athlete without problem. I've had no problems over the last 4 years, no pain, no recurrence. Everything has been great.